Hello everyone, and welcome to this Electa webinar. The title of today's presentation is Using Innovation to Address Physician Burnout. My name is Tom Chadwick. I'm the Senior Business Marketing Manager for Electa for our software products. And I will be making the presentation today, and with us as well is Dr. Ami Negandhi, who will actually present towards the end. So physician burnout is definitely on the increase. It's, I think, a factor definitely of the modern healthcare environment that all of us work within. And it's been increasing, according to the advisory board, it's been increasing quite dramatically in the last couple of years. In the data that they put together, it shows almost a 1/3 increase in the last couple of years. And this physician burnout is directly attributed to decreases in patient satisfaction scores, increases in medical errors that are reported, increased physician turnover, and also early retirement of physicians. And there are a number of factors that contribute to physician burnout. I'm not going to go through this whole list, but I think that the top 4 are really the most important, and really the abundance of bureaucratic tasks, including the tremendous amount of charting and paperwork that physicians are burdened with, which is also directly related to how many hours that they spend at work. A lot of physicians need to spend time after their busy clinical day doing administrative tasks into the evenings. And I think other factors such as the lack of respect that some physicians get from the administration with respect to some of these concerns. And also importantly is the burden that the computerization and EMRs directly affect the way that physicians are practice medicine. I think that the advisory board actually put together kind of a summary of how physicians feel are the main drivers for this burnout feeling that they receive. First is that, and actually half of them all indicated that they were emotionally exhausted due to the additional work and tasks that went on. But other factors such as the lack of clinical autonomy, the increases in regulatory burden, and being essentially overextended and generally undervalued within the healthcare enterprise are factors that they cited as drivers for physician burnout. There was a study that was published in the Journal of American Medicine in June by Dr. Amy Windover from the Cleveland Clinic, and she surveyed just over 1,500 Cleveland Clinic physicians, of which 3/4 of those responded, and she found that almost 400 of those, or 35% of those physicians within this large academic medical center met the criteria for being termed as burnout. And she went on to conclude that it likely stems from the limited time for completing the administrative tasks associated with patient care. And then she also went on and indicated that the low patient satisfaction scores are not good indicators of physician burnout. So I thought that was kind of interesting, and I encourage people, if they're interested in learning more, to look into that publication. The Atlantic magazine also, all of the, if you do a search on physician burnout, I mean, there's all kinds of publications and articles on this, because it is becoming such a huge crisis within American medicine. Last month in May, the Atlantic published a study where they looked at the use of electronic medical records as being one of the key contributors to burnout. And the main reason being that a lot of these systems are designed to as accounting systems or billing systems rather than a system designed for patient care. And one physician actually said that, you know, he was tired of wading through the irrelevant information to be able to document their care episode with the patient. And what they did was they actually were doing double documentation in a paper chart as well. And I think that that is still relatively prevalent in a lot of facilities throughout the US. If we look at you know, what this costs the health system, Healthcare Dive, which is a kind of a website that pulls together a lot of this documentation, estimated it at $1.7 billion per year. So definitely a you know, a huge cost to the healthcare system, huge cost to both payers and providers. So it's something that, you know, we should take very seriously. They went on to actually cite a study that Medscape did, and they looked at 15,000 practicing physicians, and nearly 2/3 of them were feeling burnt out, and with another 15% of them depressed, and 14% of those with both. They suggested that to alleviate some of this burnout, the reduction of bureaucratic tasks and fewer working hours would definitely help. So I think there's probably a number of ways that the healthcare system can address this important issue. I think that you know, physicians or administrators should actually provide opportunities for physicians to provide more feedback, to definitely recognize the contribution that physicians are making, going a lot of times above and beyond just caring for patients, but also taking on this administrative burden as well. Give the physicians more of a role in the decision making at the administrative level, and also provide support for some of the physicians that, you know, are becoming overwhelmed with a lot of these administrative tasks. And then I think as well to maybe adopt technologies that reduce the technological effort. And I think that that's twofold, is that, you know, that's improving some of the electronic medical record technologies, and I think, you know, that is definitely in the works. These systems are becoming better and better, more intuitive to use, more streamlined, but then also to look at other technologies to streamline this documentation of care. One of the systems that Electa has partnered with is Palabra, and for those of you that are not aware, this is essentially a voice-enabled system that works very closely with Mosaic. It's fully integrated within the Mosaic electronic medical record system. It provides full automation. It allows Mosaic to essentially be voice-enabled or supercharged with speech. It has the ability to do reverse EMR, which allows physicians to actually command the system through their voice, as opposed to having to do keystrokes or multiple mouse clicks. And really the outcome for all of this is very well organized, very complete, and very comprehensive notes. So the other thing that it's also very powerful within this physician burnout realm is that instead of having to wait days, multiple days, or even weeks to turn around transcriptions and then have the pressure of being able to release these documents and reports on the physicians, these documents can be turned around generally between 1 and 3 days. So there's a huge increase in the ability to generate these very comprehensive reports, and most of them are distributed within a couple of hours of the patients completing their visit, which is very different from a lot of facilities, because a lot of times the documentation is a huge burden and it goes on for days and weeks following the care episode. So Palabra is able to do this by offering very tight integration with Mosaic. It is almost seamless, and it provides the most amount of integration with compared to any other system. One of the founders of Palabra was a longtime Electa employee and has actually worked very diligently to make sure that both systems are very seamless. And as a physician, it's a very blurry area to see what is Mosaic and what is Palabra. They're essentially an extension of each other. So many of the physicians have actually mentioned that being able to, there are a number of pains associated with documentation. Being able to manage, all of the huge requirements that are upon them for documentation using yesterday's technology. So that's, either a paper-based system, some of the older electronic medical records, managing a very inefficient process with transcription, corrections being edited, reviewed, reapproved, more edits. Then also being able to manage, different issues associated with the generation of these reports and the chaos that ensues when reports are misplaced or not generated in a professional enough manner. So all of these are kind of working towards, contributing to the physician burnout. So there are a number of reasons why Palabra makes life easily. First, that these well organized and extremely comprehensive notes are approved instantly, and that has a tremendous effect on the efficiency within generating these reports. The endless circles of review and corrections are eliminated, so there's no need to review once the report is generated. That is also a factor in making life a lot easier, and it also requires a lot less dictation, because Palabra will actually take portions of the electronic medical record and populate reports with those blocks of text. So there's a lot less dictation, and that provides a lot greater accuracy. So there's been studies with actual Palabra customers, and they've been able to account for at least 125 hours saved per year with by taking control over the notes and documentation with Palabra. So I'd like to kind of open the floor to Dr. Negandhi from St. Peter's Health. This is an accredited facility. It's a community-based comprehensive cancer care program, meaning that it has radiation oncologists and medical oncologists. They have approximately 7 oncologists, and they'll be adding some additional physicians in the near future. So first, I'd like to welcome Dr. Negandhi to the call. If you've got specific questions for Dr. Negandhi, please enter them in the question section of the GoToWebinar tool, and we'll do our best to try and address that. But first, I'd like to maybe just have Dr. Negandhi provide a little bit of an overview of St. Peter's and their experience to date with Palabra.
Hello, can you hear me?
Yes, we can hear you fine.
Okay, perfect. So I think we started using Palabra, oh gosh, I want to say sometime last year, and we've really had a positive experience with it overall. We have 4 medical oncologists. We're expecting a 5th, and then we have 3 radiation oncologists. And at least on our medical oncology side, it's really cut down a lot of time spent on paperwork or notes. And I really like that. I don't need to go back and review my note. I can sign it off in real time. and the system, faxes this note automatically to the CC'd physicians. So they're getting it much more quickly than our previous system, which is a provider satisfier overall, and getting whoever needs the notes in real time to medically take care of the patient. A lot of our patients in medical oncology see lots of doctors. So there's a group effort, we need a huge group effort to take good care of cancer patients, and this helps in that as well. So overall, I've been very satisfied with it. You can change the formatting to the way you want, so it really plays towards my OCD with notes, that I can change things and then it'll transfer over, so I don't need to reinvent my problem list or my recommendations. I can just update them and then sign off. I can do the notes in the room with the patient, which is very helpful as well. So I can review questions that I had and then update the changes in real time in the room with the patient. And that's been very nice.
Great. And what about in your opinion, what are your thoughts with respect to Palabra and helping with address some of these issues associated with physician burnout?
I think there's so many different aspects to physician burnout, and I think with this, this has definitely cut down my time sitting in front of the computer or at a desk, and that's huge. So that's been very nice. From that point of view, yes, I think that definitely helps some of this, frustration, kind of doing computer work at the end of the day. It's much quicker to get it done. I can also cut and paste pictures. So I've actually gone to NCCN guidelines and put a mark around the updated guidelines that I can paste that right into my note, which is really nice too. And that'll be there the next time I see the patient, so I can see when I'm ordering the next CT scan or when I'm ordering the next blood work. So those things I feel help me get my job done in a more efficient manner, which definitely helps physician burnout.
Thanks. Do you think that that Palabra has helped with improve the quality of some of the notes that you can generate? You mentioned you can use pictures and text, and I would expect that for referring physicians to have all of this information at their fingertips, and for you to be able to generate this quickly would be a benefit to the quality of the notes. Would you agree with that?
Yes. It's very nice not having these check boxes, which as a physician are pretty much meaningless. They're good for billing, but they're meaningless, for me as a doctor when I'm getting them from somebody else. So it's nice not having any of these check boxes. I don't have anything that I have to click on or sign off on before I can sign off the note. What's in the note is just what I as a physician want in the note, what I feel is important, not any other boxes or other things that aren't pertinent to the patient's medical care. We've also had our billers look at the note to make sure that we're still able to, that we're billing appropriately and everything we need is in the note. And I think the advantage of not having the check boxes, but being able to pull in the previous note is, I know what I need in the note to bill a certain level, and I can make sure that that keeps getting transferred over. So that cuts down on time, but doesn't reduce my ability to bill the appropriate level I would want to bill.
Okay, and so some of your colleagues as well are using Palabra as well, and are they experiencing sort of the same kind of benefits?
Yeah, so we're all, the whole practice here is now on Palabra, and we all have, we've all had, as far as I know, a pretty similar experience. It's nice to have, you can create your own template if you want to have certain things in it. The quick phrases and things like that can be personalized. So everyone has, personalized things for themselves, while keeping to certain templates we want to use in the practice. So it's nice to be able to do that.
Great. And have you had, has there been any issues with support, or have you had to contact support within Palabra? I mean, It seems like
Yeah, so
yep.
definitely when we first got it, we got the shortcut cards, which were a nice kind of quick reference to main things in Palabra. But definitely in the beginning, I was reaching out regularly, and the responses were very prompt, which was really impressive. I don't think I had to wait more than half a day, and most of the time I got a reply within half an hour, with a fix. Not just we're working on it, but we see it, we can take care of it, and with the fix. So that's been very nice.
Actually, this is a question that's sort of been asked for the audience, and I'll just remind folks that have dialed in, if you've got a question, feel free to just ask them through the chat window. Dr. Negandhi, could you tell how long it took for the physicians within your practice to adjust to using Palabra? Any difficulty with the voice recognition?
No, we use Dragon as our voice recognition, and once we had it trained, it's been fine. Now I know how to train new words, specifically new drugs that come out are the main ones, and that's been working. Fine. That's been working very well. So I'm a pretty fast type. I type pretty fast. So when I'm in the room with the patient, I type into my note, but at my desk I can dictate into my note. And sometimes I'm doing both. But either way, it's two good ways to cut down time.
Okay, another question here. Do you feel that Palabra has improved the physician's experience with Mosaic?
I would say absolutely. I think Palabra is the best part of Mosaic in terms of the way that our Mosaic is set up. Absolutely. Using a Microsoft Word document, we're all familiar with that. So that it was pretty easy to start using the Palabra in terms of documentation because it's just Word, and we've all been using Word and know how to use Word. I expect a Mac user would need to do some adjustments, just like any Mac user would going into Microsoft Word. But otherwise, it was very user friendly, and it works very well with Mosaic. Pretty seamless as far as I'm concerned, and so that's been great.
Great, thank you. Could you comment on whether the workflow has been integrated into the radiation oncology as well? So are your radiation oncologists using it?
Yeah, they are. So all of their notes are now in Palabra too. And their note setup is very different. So I can't comment on if I know it hasn't slowed them down, but how much quicker has it made their day, I can't comment on.
Okay. But they are using it. I think that's probably
yes. Yep, they're using it. Yep.
That's good. Okay, well, I don't think I've got any more questions. Do you have any other comments that you'd like to make before we kind of sign off here?
I know. I mean, I overall, compared to our previous documentation system, the physicians here have been very, very happy with Palabra. It's easy to use. It's much more efficient than the other systems I've worked in. And I'm a community oncologist. I don't know who the other people who are listening in are, but I'm a community oncologist, so I see a lot of different cancers. And that can take a lot of time in terms of coordination and looking stuff up and making sure I'm up to date. And I want to be able to spend more time on that as opposed to finishing my notes. And this has been very helpful in that.
Great. Well, thank you very much for taking time out of your busy day to join us. And I really appreciate your insight and your experiences with Palabra and with Mosaic. I'd like to kind of close off the presentation here. If you'd like further information, there's the website for Palabra is www.palabraapps.com. There is a number of videos there if you want to get a demonstration to learn more about Palabra and how it works with Mosaic. As well, my name and my email address are listed on the slide here. If you'd like additional information, feel free to send me an email. I'd be happy to pass that along and make sure that the right information gets delivered to you. I'd like to again thank Dr. Negandhi for her time, and also all of you for dialing in and participating on this webinar. Look forward to additional webinars. I think we're going to plan to have one towards the end of July as well. So if you're available, please definitely dial in. And again, so thanks very much, and have a good rest of your day.
Thank you. You too.
Okay, bye-bye.